The other issue that you and I talked about, graduate medical education, and you and I have similar situations. You in California know that the majority of the money goes to the big cities. Doctors train there, and we talked about your wife who is a physician. Most people practice medicine within 50 miles of where they do their training. And so little of the money goes to the 26 states that have the greatest needs in terms of underserved communities. And I don't know if you've had a chance to give additional thought to that, but it's critical that we get a redistribution of the money if we're going to get a redistribution of where physicians practice in America, because they tend to stay pretty close to the area where they train.
Senator, you brought up a very good point, because I think that the data will bear what you said out, that oftentimes once you find yourself in a residency program, you end up sticking around pretty close. You start to meet people. Sometimes you meet your spouse and you establish families. And so I think it is important that we make sure that no community in the country is not considered when it comes to the opportunity to have these tremendously important professionals like you, like my wife, who provide care to our families. And so I am more than willing to work closely with you on that, because I think it would be a mistake if we allowed the real professionals who have been champions in this COVID pandemic to not be spread throughout the country.
Thank you, Mr. Chairman.